Okay, so let's look at the immune response to infections. And there's two parts to the immune system. And there's another module on this, by the way, with a lot more detail. But the two parts of the immune system that we're going to talk about is the innate immunity and the adaptive immunity. And the innate immunity consists of a system that's always in place and ready to respond. So it's really quite non-specific. So whether you get a bacterial infection, a viral infection, a splinter, anything that enters the body, the innate immunity will be the first to respond and deal with the foreign antigen. So when we use the word foreign antigen, it's anything that is recognized as not belonging to the body. Okay. So the innate system is non-specific, meaning whatever is trying to enter the body and is recognized as foreign will be attacked or dealt with, okay, through this innate system. So let's talk about some components of the innate system. First of all, there's physical barriers. The skin, the soft tissue below the skin, the mucosa, say in your mouth, actually has antibodies in it. So protective proteins that are within the saliva. Your digestive juices and the mucus that's in your digestive tract will help clear potential invaders. The acid that's in your stomach behaves or acts as a chemical barrier, right? The pH in your stomach is often between 2 and 4, so very acidic. There's chemicals that are called cytokines. And cytokines are just molecules, often proteins, that allow immune cells to communicate with each other, to bring in more cells to the area. So say, for example, you have an infection on your skin. There's going to be a break in the skin, so the physical barrier has been broken. But there's cells below your skin that can send out signals, that can release proteins called cytokines that can bring in other parts of the immune system to also fight the foreign invader or infection. Okay, so the innate immunity interacts with the adaptive immunity, and this will make more sense as we talk about it. Okay, so just think of cytokines as chemicals that can be released by certain cells to tell other cells to come to the area. And that's where the term chemotaxis comes from, right? So cytokines can behave to some cells and attract them through chemotaxis. The cells will come to the area because of these cytokines. There's also cells that are in the innate immune system that are just ready and waiting for a potential invader. And these are typically macrophages that can engulf, like take a bacteria or a virus and engulf it within the macrophage and then destroy it. And some of the white blood cells are part of the innate immune system, such as neutrophils. Don't worry if this doesn't make complete sense right now. It will later on. Okay? So think of the innate system as already set up. It's the skin barriers, the chemical barriers, and some cells such as macrophages and neutrophils that are ready and waiting for any potential invader. Okay, so the other part of the immune system is the adaptive immune system. And this is part of the immune system that takes a bit of time to recognize a specific virus or bacteria and create a specific attack on it. So say, for example, you're infected with a certain virus. Let's say you have a certain rhinovirus that's creating the common cold in you. So the adaptive immune system is going to be that part of the immune system that's going to make specific antibodies, which are proteins that directly attack a pathogen, and it'll have a memory for that specific virus so that you never get it again, right? So the adaptive immune system takes a bit of time to take effect. It can be a week or two. Sometimes it can happen in days, but then it has a memory for that particular infection, and it can produce specific attack on that particular infection. Okay, it's also very long lasting for that specific pathogen. And this is where B cells and T cells come in. So B cells and T cells are a type of white blood cells called lymphocytes. Remember I mentioned that there's 5 types of white blood cells. We'll get to that in another module. But one of the 5 types are called lymphocytes. And lymphocytes consist of B lymphocytes and T lymphocytes. And these particular cells can create a long-term memory for one particular infection. Once it's seen that infection once, it can generate a very powerful immune response the next time it sees it so that you don't get an infection. Okay? B cells can produce those antibodies I mentioned, which are proteins that are secreted by B cells and directly bind onto the infection and destroy the bacteria or the virus. And T cells can directly attack the infection and destroy the pathogen. Okay, so I'll give you a bit of an analogy. A B cell is almost like a sniper. It doesn't want to get too close to the infection, but it's more than happy to make these antibodies that are like bullets and go directly and attach on to the bacteria or virus, and then the bacteria or virus gets destroyed. T cells are composed of T killer cells or cytotoxic T cells that just go right up to the bacteria and fight it and destroy it, and T helper cells, which is what we were talking about when we were talking about HIV infections. They infect the T helper cells. Okay, so B cells and T cells are the adaptive immunity. They create long-term memory. Okay, so when you go for an immunization, you're getting an injection of an antigen, for example, into your arm that is stimulating the adaptive immune system. For example, when you go for a tetanus shot, you're being injected with tetanus toxoid, which is the toxin that the tetanus bacteria secretes into your bloodstream and makes you very ill with tetanus. So when you get an injection of tetanus toxoid, the adaptive immunity produces antibodies to tetanus toxoid and also a T cell response. And the next time it sees tetanus, so say you have a deep wound in the future, it can immediately respond with a full attack by the adaptive immune system. And that's how immunizations work, right? They're stimulating an adaptive immunity to a particular pathogen. So whether it's to measles, mumps, tetanus, all kinds of immunizations we receive, what we're really doing is stimulating the adaptive immune system. So the innate system, which is the rapid response, waiting for anything to enter your body, can respond very quickly, within hours, right? So you have cells that are in your tissue called macrophages. They're actually in many of your organs too, and they go by different names depending on which organ we're talking about. And they can directly approach the foreign substance or infection and try and engulf it and destroy it. Okay? Neutrophils, they're a type of white blood cell that can quickly get to an area of infection and fight the infection. Okay? Both of these can release cytokines, and the cytokines can communicate with the adaptive immune system and let the adaptive immune system know that they need help. Okay? And the B cells can then produce antibodies, and the T cells can produce cytotoxic T cells, which are the CD8 cells, and T helper cells, which are CD4 cells. Okay, so there's an overlap between the innate immunity that's always ready and waiting for any particular invader and the adaptive immune system that takes a bit of time to respond because it's preparing an attack specifically for that infection. Just like it prepares attack when you get an immunization, it produces a long-term memory for that particular invader. Okay, so that's how they interact. There's much more on this in the module on immunity. Okay, so here's a nice slide on the immune system in a general sense as well. So let's start just with immunity to the left there. So you have your innate immunity, and that's where it ends, right? The barriers, the chemicals, some cells that are throughout your tissue waiting for any particular attack. It's not picky. It'll just attack anything that comes its way. And then you have the adaptive immunity, which is that long-term memory waiting for a particular pathogen that it's developed a particular defense towards. So how do you get an adaptive immunity? Well, there's the natural way to get it, is just to get the infection. So say you get a particular type of pneumonia to a particular strain of bacteria. So say you get a strain of pneumococcus pneumonia. Okay, so that particular strain, your body is now going to produce a adaptive immunity to. It's the B cells and T cells are going to remember that strain of bacteria, and the next time it sees it, it can produce tremendous amounts of antibodies from the B cells and a tremendous attack from the T cells. Okay. You can also, pregnant women can pass on their natural immunity through the placenta in a passive way to protect the fetus, right? So the fetus gets passive immunity from the mother because the blood is flowing through the placenta, and the fetus and also the neonate for a month or two has circulating maternal antibodies to protect the neonate after it's born. Okay. What about in an artificial way? How can you develop an adaptive immunity? Well, we can immunize patients with a variety of different immunizations to stimulate the adaptive immunity to that particular infection. So whether we're talking about the hepatitis B vaccine, the chickenpox vaccine, HPV vaccine, tetanus, diphtheria, polio, mumps, measles, rubella, those are all injections that will stimulate the adaptive immune system towards those particular infections. Okay? Or say that you need an adaptive immunity right now because you're going on a trip somewhere, such as, say, South America, and you want those antibodies right now. Well, we can give you an injection of antibodies that will, say, protect you to hepatitis B, right? They won't last very long. They might last just 2 or 3 months, but during your trip, you will be protected from hepatitis B because we injected the antibodies into you and to temporarily give you an adaptive immunity to hepatitis B. Okay? I hope that makes sense. So in general, how do we get an adaptive immunity? We either get the infection and produce and stimulate the B cells and T cells to have a long-term memory to that infection, or we get immunized and we stimulate the adaptive immune system because we've introduced the antigen in the immunization, and the adaptive immunity has responded and created a long-term memory to that particular immunization. Okay, so how do we treat and prevent infections? Well, we've reviewed this already. In terms of medications, antibiotics are only effective against bacterial infections. Antivirals are available, but only for certain viral infections. Many viral infections either don't require antivirals because your body will clear them, will clear the viral infection, or the viral infection just isn't responsive to antivirals. We can use antifungals as a cream for superficial fungal infections of the skin, in the mouth, or vaginally. Or we can use oral antifungals for deeper fungal infections in the body. As well, we have antiparasitic drugs that we can treat protozoa, such as malaria, such as Lyme's disease, and as well worms. Okay, so they're relatively easy to treat once the antiparasitic medication is taken. We can prevent infections with immunizations that we just spoke about. So immunizations prevent infections by stimulating that adaptive immunity and creating long-term memory to that particular infection. Okay, so there are so many bacterial and viral infections that we just don't see anymore because of the immunization schedule that begins in childhood. Okay, so that's an important concept to remember, that a lot of our adaptive immunity is through immunizations, and then the rest of our adaptive immunity is through acquiring the infection, living through the infection, and then having a long-term adaptive immunity to that particular pathogen. Okay, so let's talk a bit about emerging infections, re-emerging infections, and resistance that we've already spoken about a bit. So emerging infections are new developing infections, and COVID-19 is a perfect example of this. So a viral infection that didn't exist before and that has created a pandemic around the world. Okay, and what defines an emerging infection is it's recognized as a new disease in humans. And part of the ability of an emerging infection to create a pandemic, say, is global travel, right? The ease with which we can travel around the world spreads infections very easily, okay? A re-emerging infection is an infection that was once declining significantly, such as measles or polio, but are now able to either continue to infect patients or are on the rise. And we often hear of measles outbreaks around the globe, or an outbreak of polio somewhere. And it's because the virus, when we're talking about measles, has significantly declined in the number of patients it's infecting. But because not the entire globe is vaccinated to measles, there's still potential for patients to get infected. And also, not everybody that has the ability to get vaccinated does so. Okay? So the pathogen can adapt or mutate and have the ability to enter the body once again, even with a vaccination, since it adapted and mutated, or the incomplete vaccination around the globe, which is definitely the case. Okay, many countries are not well vaccinated to infections. And how does it get to other countries? Global travel, right? And then the infection reemerges again. When we're talking about resistance, we're talking about antivirals or antibiotics in particular, even more importantly, that once killed a pathogen are now no longer effective. That's what we call bacterial resistance. Okay, or antibiotic resistance, in fact. So how do bacteria develop this resistance? Well, they can either mutate or they can adapt. And the way they adapt are with plasmids. So plasmids are just little tiny bits of extra DNA in the bacteria that can produce a protein that can now make the antibiotic that's in the system ineffective. Okay? Viruses can also become resistant. So, for example, HIV, the virus that can lead to AIDS, can become resistant to HIV drugs. And that is partly why patients with HIV take 3 or 4 HIV drugs at the same time to try and stop the virus from replicating and never mutating. Okay, because the 3 or 4 antivirals are keeping the virus from having any possibility of replicating in the cells. So you can have antiviral resistance or antibiotic resistance. Okay, so how can we prevent antibiotic resistance, which is by far the most important medication we have to fight bacteria, right? And it's much more important than antivirals because we just don't have that many antivirals. But you'll see when we're talking about particular viral infections, we will mention resistance. For example, when we're talking about HIV. Okay, in terms of antibiotic resistance, how to prevent it? Well, don't take antibiotics for prevention, right? So a patient that comes in with a viral infection, and they say, well, maybe I just need an antibiotic to fight off this infection I have. No, you don't need an antibiotic because viral infections don't respond to antibiotics. Okay, there are a couple of circumstances where we do use antibiotics to prevent infection. I'll give you one. So someone who's going for a dental procedure and has a damaged heart valve, or they have a heart murmur. When you have a dental procedure, or a surgical procedure for that matter, and you have a heart murmur or a damaged heart valve, when you have the dental procedure, some bacteria gets into the bloodstream, and that can then get onto the damaged heart valve and cause an infection of the heart valve. So because the heart valve is damaged in some way, it makes it more prone for bacteria to attach to it. So anyone who has a heart murmur or a damaged heart valve will get antibiotics prior to a dental procedure, okay? And the same would go for some surgical procedures where you might get antibiotics prior to the surgical procedure because you have a heart valve condition. Okay, so not many examples of where you need to take antibiotics to prevent infection. Another example would be sometimes we'll give antibiotics for a significant cat bite or a dog bite to the hand. Well, because cats and dogs puncture into the hand and put bacteria deep into the tissue, sometimes we'll just give a patient antibiotics to try and prevent any infection from occurring in the hand, okay? So in general, not to take antibiotics for prevention. Washing your hands well to reduce the spread of infection, especially in hospitals. We're always washing our hands in the hospitals. We have alcohol dispensers all over the place to remind us to wash our hands prior to going into another patient room. Following medication directions, so completing the entire course of the antibiotic. If you just take 2 or 3 days of an antibiotic that was supposed to be for a 7 to 10 day course, then all you're doing is getting rid of the non-resistant bacteria, and you're ensuring or increasing the chance of the resistant bacteria taking over. So following and completing the entire course of antibiotics is important. Not to take antibiotics for a cold or a flu, because those are viral infections. Antibiotics won't do anything for them. Always teaching patients to finish the entire course, which we just mentioned, okay? And never to take someone else's antibiotics. Not to skip antibiotics, because again, skipping antibiotics allows some of the bacteria to start to regrow during those missed antibiotic doses, okay? So when we're talking about antibiotics or antibacterials, which is the same term, there's some antibiotics that will destroy and kill the bacteria directly. And we will refer to those antibiotics, and you'll learn this in pharmacology, as bactericidal, meaning they kill the pathogen, i.e. the bacteria, directly. And many of these do it by destroying the cell wall of the bacteria. That's not always the case, but for example, penicillins, that's exactly how they work. They destroy the bacterial cell wall, so penicillins are bactericidal. Other antibiotics, such as macrolides, and I'll give you an example of a macrolide, erythromycin, azithromycin, maybe some of you have heard of, clarithromycin. Don't worry about them right now, but they don't work by um, destroying the cell wall. They work by stopping protein synthesis within the bacteria. So they don't actually kill the bacteria, they just stop the bacteria from dividing. So they're bacteriostatic. Okay? So there's some antibiotics that are bactericidal, and there's some antibiotics that are bacteriostatic, and they just stop the growth of the bacteria. Okay, and then we have antiviral medications that the main way they work disrupt the way that the virus is trying to replicate and producing new viral particles. Okay, and finally, antifungal medications. They prevent a certain steroid type molecule called ergosterol, and this is part of the cell membrane of the fungus, and by stopping production or synthesis of this molecule, the cell membrane gets destroyed and the fungus dies. Okay, so let's just go over some terms and definitions here. So an antibody titer. So an antibody titer is basically a blood test that we can check the presence of the level of antibodies that you have to a certain organism or pathogen. So for example, if you have had a series of hepatitis B shots, well, you can go for a blood test afterwards and have your antibody titers to hep B checked to see if you have high enough titers that you're actually immune to that particular infection. Okay, so and we can do that for other infections as well to check antibody titers. Okay, and often when you're entering a hospital to work, they ask for evidence of your vaccinations, and sometimes antibody titers are also checked to see that you have immunity. So the term congenital, what does that mean? That just means a condition or a disease that has been present since birth. So whether it's a cleft lip or a cleft palate or any other congenital anomaly or condition that's occurred at birth, we call it congenital, right? What's an inoculum? Well, an inoculum is just a substance that has been injected into a patient to create immunity, and that's typically adaptive immunity. Okay, so basically a immunization or a vaccination is an inoculum. Bacteremia is just the presence of bacteria in the bloodstream, and this can occur from an assortment of locations. So whenever you have a dental procedure, there's a bit of bacteria that get into your bloodstream. Most of the time it's not a problem at all because your immune system can easily deal with the bacteria that's entered the bloodstream. Say you have a pneumonia, so a bacterial pneumonia, and now some of the bacteria that's in your lungs is now going into your bloodstream and you're bacteremic. And it can occur with a kidney infection, where as the kidney infection gets more and more severe, some of the bacteria can now start to invade the bloodstream. And what bacteremia can lead to is septicemia or sepsis. And that's the combination of having an infection, such as a bacterial infection in the blood, plus the body's tremendous inflammatory and immune response to the infection that's now in the bloodstream. And that typically makes a patient very ill. Okay, they're often unstable in terms of their vital signs, low blood pressure, fast heart rate. They often have multi-organ failure, so they can start to go into congestive heart failure, renal failure. They can present with confusion because their brain isn't functioning properly. So septicemia is a very serious condition. Okay, so we're almost done this module. Here's just some terms and definitions that we'll come across as the modules go on. So sepsis or septicemia. So this is an infection, typically by a bacteria that enters the bloodstream. When a bacteria enters the bloodstream, we call it bacteremia. It's just bacteria in the blood. That's it, bacteremia. When it causes the body to set up a severe inflammatory response with unstable vital signs, so low blood pressure, fast heart rate, potential organ failure, such as your kidneys start to fail, your brain is not functioning, so you're confused, you're very ill with this condition because you have bacteria, plus you have this incredible inflammatory response from the immune system trying to fight it, and it's creating very unstable vital signs and multi-organ failure. So for example, your heart may start to fail, your kidneys may start to fail, and this is typically a life-threatening infection, and we try to get antibiotics on board as quickly as possible for sepsis. Okay. The next two topics are just to mention some resistant bacteria. So I mentioned before MRSA, methicillin-resistant Staphylococcus aureus. So this can be a hospital-acquired MRSA or a community-acquired MRSA. Hospital-acquired MRSA tends to have an incredibly high resistance to antibiotics. And that's why when in a hospital someone develops MRSA, they're usually isolated in a room by themselves to stop this particular bacteria from spreading throughout the whole ward of the hospital. Okay? And how is it spread? Typically from direct contact, right? Hand contact that then takes it to another room. And that's why hand washing is so critical. Okay? MRSA is screened for when someone is admitted to the hospital. So swabs are taken from the nose and they are sent off to make sure that the patient doesn't or isn't a colonizer of MRSA in their nose, for example. VRE is another example of a very resistant bacteria. Vancomycin, which is an antibiotic, so vancomycin-resistant Enterococcus. Just another bacteria that's highly antibiotic resistant. And again, how is it spread? Direct contact or by being on furniture, on the bed, and those are called fomites. Okay, not typically by coughing. And this is also screened for all patients coming in to be admitted to a hospital. So they will get swabs as well. And it's typically rectal swabs. So because Enterococcus is in your colon. So VRE is vancomycin-resistant Enterococcus, MRSA, methicillin-resistant Staph aureus. Okay, so the end of this module. I hope you've been able to take some information away from it. Again, we're at 2 hours and 30 minutes, which is where we're trying to keep these modules to. And here's a lovely picture of a macrophage that is engulfing a foreign substance, right? So it's going around the substance and bringing it into the macrophage, and then it's going to digest it. and macrophages are part of the innate immune system. Okay, so this information on the innate and the adaptive immune system will definitely continue in another module, and it'll make even more sense once we do our module on the immune system. Okay, if there's questions, bring them to class so that we can discuss the different aspects of this module and to clarify any points that may have been confusing. Okay, see you at next module.